I really think it's more of, again, because you don't really have the full aspect of a background of what infection prevention entails from a nursing standpoint. I think some organizations do really well of educating that to the nursing staff, but I think it's more of, it really starts with outcomes, right? Of, if you have interest in improving patient outcomes at a just very basic surface level, you don't have to know what goes into uh, driving those initiatives, but seeing like, hey, people who are coming to the hospital shouldn't be leaving worse than they came in, or we shouldn't be giving people infections that they didn't come in with. If that is something that you know sparks an interest in a nurse's mind and drives passion to them to want to improve the outcomes that they see, that in itself is what infection prevention, is the basis of it. So I think that would probably be my speaking point. I do have to say though, you know I I'm a nurse. I'm grateful for my background, but I think that we haven't, up until recently, been looking at other fields and how much they have to offer to the world of infection prevention. And I think we do a disservice if we're so focused on just bringing in nursing into infection prevention, because some of my best mentors that I've had the pleasure of knowing over the years have a master's in public health or clinical lab specialists. And naturally, your brain as a nurse, the way that your education is taught, doesn't go towards the lab regard or the public health field. You get, a semester of, a little bit of both, but the opportunity and the wealth of knowledge that they could bring and, develop a team and make your team versatile. Those are the people that I want more to come into the field of infection prevention. Absolutely grateful for all the nurses, and will forever have a need for them in the field of infection prevention. But I would love to see the field and develop more with, MPHs and the lab backgrounds.